Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day.
Behind every wound is a real story. And today we are looking at chronic leg ulcers that fail to heal, a condition many patients struggle with for weeks or even months at home. That is why we approach wound care from four perspectives: what the doctor evaluates, what the pharmacist safeguards, what the dietitian supports, and what you at home can manage day to day. This is your nursing perspective. There is a way chronic leg ulcers often begin: quietly. Sometimes it starts as a small cut or wound, dry, cracked skin, or a blister, swelling in the lower leg, or a minor scratch that does not heal. At first, it does not seem serious. It's just a small sore. It will heal on its own. And sometimes there is brief improvement. But then the wound remains open. The skin darkens, fluid begins to leak, pain increases, swelling worsens, and slowly a pattern begins. Dressings become soaked more frequently. Walking becomes uncomfortable. Odor may develop. Healing slows instead of progressing. At that point, it is no longer a simple wound. It is a chronic ulcer. From a home care point of view, the first step is simple: observe before you react. Pay attention to size of the wound and color changes in the skin, amount and type of discharge, and swelling in the leg, increase in pain, presence of odor, and the condition of surrounding skin. Check the frequency of dressing saturation, because chronic wounds often worsen gradually before complications become obvious. Now understand what may be happening. Leg ulcers are rarely random. They are often linked to poor blood circulation, diabetes, or venous insufficiency, persistent leg swelling, pressure injuries, infection, or poor wound care practices. When circulation is reduced, oxygen delivery to tissues is limited. The skin becomes fragile. Fluid accumulates in tissues. The wound struggles to close. This creates an environment where infection can develop easily. And once infection sets in, healing slows further. Now let's talk about home wound care. When managing a leg ulcer, wash hands before and after dressing the wound. Keep the wound clean and properly covered. Change dressings as instructed. Do not reuse soiled dressings. Avoid applying unapproved creams or herbal mixtures. Protect surrounding skin from excess moisture. And remember, a clean, well-protected wound heals more reliably than one frequently disturbed or improperly treated. Now consider swelling. Swelling is one of the main reasons wounds fail to heal. When fluid builds up in the leg, pressure increases around the wound area, reducing blood flow and slowing repair. That is why elevation is important. When possible, elevate the leg above heart level. Avoid long periods of standing. Avoid sitting with legs hanging down for extended periods. Use compression therapy only if prescribed, because controlling swelling supports healing. Now pay attention to wound drainage. Some fluid is expected in healing wounds, but worsening or abnormal discharge is a warning sign. Watch for thick yellow or green discharge, blood-stained fluid, or a strong or foul odor. Watch for a sudden increase in drainage. These may indicate infection. It is important to remember, a wound that does not improve over time is not normal healing. Even if pain reduces temporarily, even if it looks slightly better on some days, healing should show steady, progressive improvement. If the wound remains open, enlarges, or repeatedly worsens, it requires medical review. So think like a nurse at home. Observe the wound regularly. Track changes over time. Monitor swelling, note drainage patterns. Pay attention to odor and pain. Observe surrounding skin changes. Because the pattern is the message. Now know when to seek urgent care. Do not delay if you notice fever or increase in redness or warmth, severe or worsening swelling, blackened tissue, or pus-like discharge, foul smell, severe or escalating pain, or red streaking from the wound, rapidly enlarging wound, or difficulty walking. These may indicate serious infection requiring immediate treatment. Now step back and look at the bigger picture. Wound healing depends on circulation, infection control, nutrition, swelling management, and proper daily care. Everything is connected. So the key message is simple. Do not ignore wounds that fail to heal. Do not overlook swelling or drainage. Do not delay proper dressing care. Monitor changes closely. Maintain cleanliness and seek help early when healing slows, because early attention prevents long-term complications. And remember to explore the other three perspectives: doctor, pharmacist, and dietitian, because each one completes the picture. Need guidance? Contact your healthcare provider for proper evaluation, or call or WhatsApp +233 208 720 347.